and wanted to just take a minute here before we get started to thank our sponsors. So I wanted to thank our title sponsors, which is Wellbridge Surgical, TrueRx, as well as ELAP or Imagine 360, who we will get to hear from today. But I also want to thank our other sponsors, our advocate sponsors, which is Unified Group Services, Granite Peak Analytics, RX Health Centers, Stealth Partner Group, Green Imaging, and TPAC underwriters. They've been great support in getting this series going, and honestly, they're great support in general for just for our business. Some other sponsors and partners of ours is Principal Financial Group, Delta Dental, AIM Medical Management, QBE, Lincoln Financial Group, MetLife, Catalyst, eHome Counseling, and Springbuck. And I know I just listed a lot of names, but if you're attending and if you were taking notes, we just kind of gave you all the secrets, all the partners that can help you be successful. But actually, that's really true. We have a lot of partners that help us build custom health plans that are supportive to particular employers. So before we get into our session, I wanted to invite Bob Wolfkiel from Imagine 360 to take a few minutes to share about them and about what they're doing in the healthcare space. So Bob, thanks for being here.
Thanks, Ben, and good morning or good afternoon, like you said, depending on where you are in the country. Quick intro, I got a few minutes here, but Bob Wolfkiel, I'm the Regional Vice President for Sales for the Midwest region and the West region for Imagine 360, formerly known as ELAP Services, as you saw our old logo on the screen. So again, thank you for the Connor team for allowing me for a few minutes. But, I've been speaking at different engagements throughout the country this past several months, and we tend to spend a lot of time on really three items, which I'm going to focus on in my few minutes. Is one, the problem, which I consider the problem, what's happening in our country today, which I think, we talk about consistently, and Connor does a wonderful job there. Overview of who we are and pretty much how it works from our company's perspective. I'm also good if I have a few seconds here, but can I share my screen real quick, Ben, or is that okay? Okay. Yep. Just real, I guess, quick from a problem perspective. And I think that's what really, attracts me to these types of meetings. I've been in the business for 32 years and worked for the big carriers and had good careers there, but there was really no true understanding of the problem or solution. And I was at a presentation in Las Vegas a few months back, and we were speaking about what the real problem is. And the problem, and from my perspective, is how healthcare impacts not only the employer, but the end user, the member. And you might know these statistics, but I'm looking at them right now. 60% of the people in this country need to take a loan for a $1,000 deductible. 1/3 of people delay care because they can't afford it. As you probably know, there's 110 million people out there that are in medical debt. And 20% of surgeries unnecessary. And I think the one that was most interesting to me was hospital pricing. 60% of the time, a cash price is less than a contracted price. So if you think about that, from a healthcare perspective, our system's absolutely broken. And as an organization, Imagine 360 is the first integrated health plan in the country, integrated RBP health plan in the country, I should say. And we tackle things differently than your traditional insurance PPO type program. We deliver savings anywhere between 15 to 30%. We grow 30% a year roughly based on this model. The most important thing about it is we do focus on the member experience and how it impacts it. And it's real important to understand that healthcare, unfortunately, over the years has really been a quote unquote status quo type product where people just don't really personally engage into their healthcare program. And the fact that it's so expensive, it's real important that they do. And under our model, basically what we do is we focus on the hospital cost. And you'll see that in the center of your screen where, you know, the hospital systems typically focus on, they do focus on a charge master price, which is on the top of the screen there with $5,000, which is a pie in the sky, unknown number, which they pull out of the sky, in my opinion, where your typical PPO applies a 50% discount. In this case, it'd be a $2,500 payment for a self-funded arrangement. And what we do is we work from the bottom up. When we bottom up, what I mean is we take Medicare, which is the largest payer in the country, their pricing model, or the actual cost of the facility, and we add 12% to the cost or 20% to the Medicare level of reimbursement, and we pay the higher of the two. So that delta in this case of 2,500 between 336 is where the savings is driven, is how we drive 15 to 30% savings. So with that said, I think it's real important that you understand that we tackle the root cause, and 10% of the claims are coming from the hospital. And by doing that, we're able to deliver the savings at the same time through our concierge service model and the programs that we offer. We're able to obviously support the member effectively. So, you know, selfishly, we would welcome an opportunity to work with Connor and anyone on this call, talk about your current health plan and see how we can help you, develop a better program that fits your needs. So, thanks, Ben.
Bob, thank you. Thanks for being a good partner. So we've been working with eLab now, Imagine 360, since 2015. And it's been quite the journey together. And we've seen the success they can deliver, and quite honestly, the what can be built when you're able to remove inappropriate costs from a health plan and how to reconstruct it from there. So thanks again, Bob. Which that takes us to the stars of the show, who I'm going to read their bios, because I think it's important to know the professionals that are going to be talking through healthcare. And what's going to be interesting is I know they're going to do a great job, and this is just part of their role to some extent. They have a lot of other things that they do, but the first panelist I want to introduce is Angie Kuzma. She is the benefits manager at Life Science Innovation, otherwise called LSI. And Life Science Innovations is a shared services organization providing tailored professional services in the areas of HR, IT, accounting, administrative services, partnering with their customers to become an extension of their team. Angie has over 20 years of experience in the human resources field and has been involved with overseeing benefits plans in various capacities for the past 13 years, with the last 6 years focused on self-insured plans. Currently, she helps manage 5 different benefit plans that are offered to over 2,000 employees. And I'll highlight that. She manages 5 benefit plans. I know for a lot of us, managing one benefit plan is plenty. But she deals with 5, and she does an excellent job. Angie's passionate about finding win-win solutions for her customers and their employees through innovative plan design. Our second panelist, Nate Thorne, is the assistant town manager for the town of Plainfield in Indiana. In his role, Nate serves as the chief of staff and directly oversees administrative functions of the town, including human resources, budget, communications, information technology, and other support service functions. His human resource responsibilities include direct oversight for all employee health plan benefit management and negotiations. Nate has a bachelor's degree in business and human resource management from Indiana University, Indianapolis, Kelley School of Business, and a master's degree in public affairs and public management from Indiana University, Indianapolis, the O'Neill School of Public and Environmental Affairs. Nate has served on many boards and commissions throughout his career, including nonprofits, community groups, schools, and related committees and associations. Currently, he serves as the president of the Indiana Municipal Managers Association. Nate's service in these roles often is requested to provide counsel and ideas for human resources and leadership management related to insights and services. Nate is also an active volunteer for his kids sports program, currently coaching youth basketball and middle school swimming. So Nate does a fantastic job of leading the town of Plainfield and really looking out for his community. You also might know by that bio that Nate rarely probably sleeps because he's doing so much during the day and in the evening with his family. And lastly, but certainly not least, is Tammy Dickinson, recently joined Banning Engineering as a human resource manager. Banning Engineering is a civil engineering firm located in Plainfield, Indiana as well. So we got some great representation from Plainfield, Indiana. But they specialize in site development, transportation, and surveying. Her role is to manage the day-to-day HR activities, recruiting, employee benefits, and other support functions. Tammy has a bachelor's degree in business management from Indiana Wesleyan University. I'm a fellow alum. And prior to coming to Banning, she worked for a global manufacturing firm for over 20 years and served as their U.S. Human Resources Director for the last 10 years. Tammy enjoys volunteering in the community, traveling and boating at Lake Cumberland in Kentucky, which it's about time. It's about that season. So we'll get going. Let me pull up my notes here. But before we get started, I know I read your bio, but maybe if you guys can share a little bit about yourself and your company and kind of your role around the organization's health insurance plan, or maybe even what gets you up in the morning to like really dig into this topic. And Tammy, we'll start with you on that one.
Well, great. Thanks, Ben. So coming on to Banning 2 years ago, I was excited to move into a space where, we kind of had that personal touch back again. And I think that's what I really enjoy is just working with to be able to problem solve, build relationships and develop strategies that really can impact, families and employees. When I got here, our company, our owner had been the owner, Jeff Banning, for 28 years. He's coming on his 29th year this year. But last year we became an ESOP. So being an employee-owned company really changed our strategy with how we were going to approach things going forward. It's not just one person driving it. Now it's going to be a group of a team to drive it. And we wanted to make sure that the employees felt that they were getting and understanding what they were actually paying for as a company now. And so I think that's been a big strategy change for us in the last year, and it will continue to be. They've previously came off of quite a few increases through their healthcare, and that was another driver. So, but I really think that, this ownership that these employees have really embraced it was good timing for moving to this next generation and thinking about things differently and instead of spending, $1 million for a company our size in healthcare. How better can we spend that money? How can we reinvest in the employees? How can we reinvest into the company?
Yeah, $1 million is a big deal when it comes to being a part of an employee's compensation package, which at times maybe doesn't necessarily feel that way from an employee's perspective. Angie, tell me a little bit again about yourself, your company, and kind of what gets you up in the morning to run all 5 benefit programs that you run.
Yeah, thank you, Ben. So as Ben said, I have 5 different organizations that I get to work with every day. My career actually with our family of companies started out with one of those organizations, and I used to do all aspects of HR. I enjoyed human resources very much, but I always found myself completely engaged in benefits. Just digging in more, trying to research more and find out more. So a few years ago, I was able to take the benefits manager role. So instead of just working with my one organization and company, I can now help 5 different companies better manage their health plans, look at new strategies around pharmacy, or look at potential on-site clinic options. And just be able to find the best solution for both the employees and also help organizations save money and put money back onto the bottom line or reinvest in our employees and their overall wellness.
That's great. Nate, tell me about from your perspective as leading, and I think definitely a difference of leading a town and having to shepherd or steward, if you will, taxpayer money. So tell me about how you view your role around the organization's health insurance plan.
Well, first, thanks for having me, and I'm excited to share some of our experiences. But you first asked what gets me up in the morning, and this is my health insurance too. And so I always tell our employees that every day I go to work and try to find ways to not only be good stewards of taxpayer dollars, but I also want the best benefit I can get for myself, and by in turn, then that goes to the rest of our employees and their families. And so I think sometimes we fail in that piece of the understanding of that we're doing it for our families too. And so in municipal government, oftentimes there's lots more bureaucracy. I know that you certainly have boards in a lot of other companies, but I've got about 40,000 residents that are also my bosses. So there is a lot of hurdles in municipal government. However, what we have been trying to do really on this journey since about 2016 is bring the business acumen to the public sector. And it's hard work, but it certainly can be accomplished. And I think that we're a good example of such. But I think that the stewardship piece of taxpayer dollars is always going to be front and center, as we only have so much that we can raise as far as property taxes or other ways to bring in money to the town, and we have to use that the best we possibly can. So we have to stretch it as far as possible. And to do that, we got to be creative. And for too long, municipalities have hired brokers that aren't Connor and just say, okay, what's my trend increase for the next year? And then we just take it. And in the town of Plainfield, we have got far away from that and continue to run away from that. And we hope by doing such, we're giving a much richer benefit to our town employees than a lot of other municipalities. And we're happy to share this information with anybody of our experience, and hopefully it helps you in some way.
Yeah, thanks, Nate. Man, you throw out that dreaded trend word, it's almost bait. I almost want to go down that path, but I'll resist the temptation. But let's rewind the clock a little bit, because I know all three of you have taken steps, some small, some big, to change things, to change the deliverable for your employees. And some of you have done that sooner rather than some of you have started this journey kind of a while ago. So if we can rewind the clock, going back to your past self, what challenges were you seeing in particular with your employees, with your company, and with your benefits that really started to bubble to the top and kind of put in your mind that we have got to do something different? And Tammy, I'll go back to you.
Okay, thanks. Well, we're new, right? I mean, we're new to thinking we went from a fully insured plan to a self-insured plan. And the reason, we were looking at that was we had grown in size and we were able to cross over, which was a very good thing. But also that when we were with a fully insured plan, we were with a trust. So even as a small organization, we got this benefit of this large trust that we thought we were buying into that would provide us information. And really, it provided us nothing. I mean, it kept the cost down, but it really didn't provide us any more information. And so when we got to a size where we could move into the self-insured kind of arena, it was, let's go, because we felt like we could capture data and we could use that data to be more targeted, both for the employee and for the company. We also felt that, our company has a very unique value. We pay zero as an employee, zero premiums for our benefits. So the company has always taken that on at 100%. And that's a strong value for the leadership team to continue. And, it's when the increases were coming, you looked at how you could do that. Well, the only way at that point you could do that was through plan design. And so with the plan design, we were really only shifting cost back to the employee by using deductibles and out-of-pocket maximums in order to control costs that the company was paying. And so that got to a point where we're like, we can't do that anymore. So how else can we use, some other strategies? And that's when last year, we met with Connor and you guys, and we started really coming to the table and saying, what else is there? What's new? I had seen Connor in the space, being here in Central Indiana quite a bit. And so we definitely reached out, and it seems to be so far a great partnership that, and we look forward to putting some tools in place that we have now and then expanding on it into the future.
Thanks, Tammy. Appreciate that feedback. I think Ben's having some technical issues, so I will continue to move the conversation along. Angie, what about you? What are your thoughts on that?
Yeah, our journey actually as an organization started about 10 years ago. In 2013, our companies were facing a very large increase, and we were on a fully insured plan. So in 2013, we had partnered with Connor, found the right partnership there, and ended up moving our plan to self-insured. Also at that time, we created a captive layer. So all of our companies buy into a captive layer and help insure those additional costs. I think our biggest win as we look at that is there have been some bad years. There always are some. And I think our very first year, we were all wondering, what are we going to do here? But over the past 10 years, we've actually seen a negative 1% trend as far as what we would look at as our premiums for our organizations. So where many companies are seeing 6% or larger trends year over year for increases, over the past 10 years, we've actually been able to hold a negative 1% trend, which has saved our company many, many thousands or millions of dollars as we look at it. So taking that step in that direction to go self-insured was definitely one of the biggest wins. And like you said, Tammy, having Connor Insurance there to help assist us along the way, create that captive layer has been a huge win for our organization.
Thanks, Angie. Nate, what are your thoughts?
Well, I appreciate Bob's introduction about the impacts on employees and their families, because that's exactly what the tipping point was. Somewhere around 2015, we were fully insured as a town. We had partnerships with brokers and others that just came in and told us what that trend is, and Ben won't go down that bad road. But we are in a municipality. We have police officers, we have firefighters, we have DPW employees that could not afford the premiums, and they certainly couldn't afford higher deductibles. And when they need their insurance the most, as a town, we wouldn't be able to be there to see it through. And we can't just go raise taxes whenever we want, contrary to maybe some of the public beliefs may be. We just can't do it that easily. So we had to do something different. And so when you see your employees, especially the ones that service us, that come to our aid when we need them the most, and fear that they're not going to be able to pay their bills, or they're going to have some type of debt because of healthcare coverage, we had to do something different. And so that tipping point came home, and that tugs on your heartstrings. So to our elected officials and to all of our leadership, that is a pretty blunt reason to have to rethink what we had done for 50 years prior, and just kind of going through the motions of what insurance was to all of us. So we went on a journey that we're still on the journey. It never ends, because we're always looking for creative ways to really look to enhance benefits while managing costs. And I tried to take a little bit of what I hear on all the next gen stuff. Some of it I scratch my head for. One of the next gen folks used to say that insurance is an expense. It is. However, we say insurance is an investment, and I'm investing in our employees. And so what better way to show your values than pouring into the employees and finding creative ways to get them quality investment and returns for their health insurance than looking and working really hard to be creative and being able to deliver that. So yeah, the employees basically called uncle, and we had to do something about it. And so I'm sure that Ben will ask some of the questions here to get into some of those details, but that's what really did it for us. And we just couldn't take it any longer. We had double-digit percentage increases from 2013 through 15. We couldn't do it anymore.
Yeah, that's just unsustainable. And I'm back after some internet issues. Just to circle back on one thing, Tammy, you mentioned that once you grew in size and you were able to go self-funded. I think there could be some people on like pins and needles of like, what's that size? If you wouldn't mind sharing how many are on your plan or how big your organization is.
Currently, we have 55 employees on our plan. So, for us, the threshold seemed to be that 50 number. When we moved to that number, and that was kind of our teetering point, and it was also coinciding with 2 double-digit increases as well, like Nate was saying. In fact, it was, a 27% and a 29% increase 2 years in a row. So, we couldn't just sit on our hands and say, okay, because that's with the leadership value wanting to keep no premium cost to the employee. We had to have some really good strategies in place, and we were at the right size at the right time. So it all kind of came together.
Yeah, and I think there's probably a lot of people that are really surprised that you said 50. They were expecting you to say a bigger number. But what I think is interesting is, you guys saw an issue and you had to pursue the option of what's new or what can we do differently. And just in full disclosure, the Connor Insurance, our organization went self-funded, and we have 25 on the plan. So it's not necessarily, there is a size element of how much premium is being paid, but there's an element of like, what's the strategy? Like what's going to like change the course or provide you a different outcome than what everything else, does or how it's built. So going back to what Nate said, Nate, really, you talked about the challenges of how it impacted your workforce and the problems that you saw. Angie or Tammy, do you guys want to add any comments, particularly about the challenges or how you saw it negatively impact your workforce as you saw some of those increases or problems?
I think it just comes back with that plan design for Banning. We were really feeling for those few individuals, they were really having some pain points with some of those high costs, and not, even though they were part of a network, the options to be able to be a consumer wasn't there either. And that was kind of a pain point because they were just being directed and not really thinking about anything. And I think, so that's been a really neat thing that some people are like, oh, I didn't even know those things were out there, since we've becoming on board the first part of the year. They're like, we just always thought we had to go where my doctor sent me. And I'm like, no, you don't have to go where your doctor sends you. Amazingly, you don't. And so that's been kind of a win for us in some regards, but it was just a challenge that, people didn't even know they were facing, that they could have bad quality healthcare. That has been kind of brought to light since the beginning part of the year. So.
Yeah, I think to echo that, there have been numerous challenges along the way, especially for our groups. One of our biggest challenges that we faced is, and continue to face today, is education. Education to the employees of alternate options, of using resources and tools to price out your healthcare. And especially for our groups, with the 2,000 employees we have, those groups are spread throughout the entire US. And we also service employees that have multiple different languages and backgrounds in different education levels. Our population is from people with PhD level degrees to those who maybe don't even have a high school graduate degree, or even maybe have a basic understanding of the ability to read English. So our population is huge. So that education piece of just the different resources, different tools available, and how do we help employees understand healthcare is the biggest thing. Tammy, I think you brought up a great point. You don't have to go to the doctor that maybe you get referred to. You can find alternate resources and tools and go to maybe a lower cost imaging provider. So how do we incentivize those right choices and help our employees clearly understand that?
Great. And just for the audience, if you have any questions, feel free to put it in the Q&A as we continue, and we'll try to get to some of those. But before we get into to kind of the guts of like what you all are individually doing, when did you decide, or what was kind of the moment for you all when you're like, you know, outside of the increase or whatever, but what was the moment where you guys were like, hey, we need to do something different? And what were you hoping for at that time as you started that pursuit? What were you hoping to accomplish in kind of changing up the healthcare delivery for your employees?
I can jump in. I would say that beyond the impact on the employees, we started talking to folks outside of the traditional broker relationship that we had single source information for a long time. And it kind of just echoing some of the conversations already is you didn't even know what was out there. And if you could apply some of the principles to, and in our case, a municipality, because that's for the business world, that's not for government or whatever the reason was. But I think the moment in time for us was when we got finally somebody from the outside in to say, hey, there's some ways that maybe we could do something differently, because it just wasn't shopped like it is now. You would maybe go for a broker RFP once every 5 or 10 years in a municipality, and then you just took whatever they brought you. And so I think that letting in those outside influences often sometimes we're afraid of. Once we finally broke through and opened our mind a little bit to some of the possibilities, knowing the struggles our employees were going to face, I think that's really what did it, and education matters. And having a little bit of that information is really, I think, what led us down the journey. And what we were hoping to accomplish, we've done it. We have kept prices low for our employees. We've increased their benefits for years now. And we keep working really, really hard every day to not rest on our laurels, to not give up. We're going to keep doing it. But hopefully that answers that question.
By increased their benefits, you mean improved, right? Increased the value of the benefits.
There's all kinds of increases, but not into their premiums.
There you go. That's good. And I know that is like a passion project of yours. You know, one thing you said that just kind of resonated, and I think it can be scary if this is not like your primary lane, is you just kept asking more questions. And you were hoping that if I just continue to ask more and ask good questions, maybe I'll find my way out of this rut, if you will. Now this next question is going to be for all three of you in particular, because we all come from different perspectives. But as you have learned about new and different ways to construct a health plan, so now we're talking about what we've done. What has been the most interesting aspects to you personally? So that could be things you've enjoyed learning about, or the things that you're most proud that you've been able to solve for. So, definitely want all three of you to weigh in on this. So Angie, if you wouldn't mind starting out.
Yeah, I think then a couple of the items on our journey with you guys by our side and helping guide us along the way that have been really impactful to me as I have witnessed has been in 2019, we actually made the choice and the move to change our pharmacy benefit manager. We moved from one benefit manager to TrueRx. At that time, we started down our kind of journey and how do we manage our pharmacy plan better. We moved to step therapy programs. We've moved to a very narrow formulary to help focus those kind of expenses. And then in 2020, we actually added RX Help Centers to some of our plans. RX Help Centers came alongside us when we decided to exclude orphan medications. And we're able to be there as an advocate for our employees to help them source their medications in a different way. Since 2020, actually, all of our companies have not only excluded orphan medications, but also excluded specialty medications. That last year alone saved us over $400,000 across our medical plans. When we exclude those medications, it's not like we're cutting off those resources to our employees. We're just sourcing those in a different way. And oftentimes when you exclude medication, the employee can get advocacy for that and get those medications for drastically reduced or free costs. So we had employees that were maxing out their max out of pocket within the first couple of months. They would hit their deductible and then they would hit their 90% or 10% co-insurance and be hitting their max out of pocket right away. So it was a real negative impact to their financials. By implementing these strategic initiatives, we've been able to walk alongside them and partner with them and save them money and save the plan money, and still make sure our employees are taken care of.
That's good. And that can be a scary thing, like, oh my gosh, exclude. Why would you do that to somebody? But it's really, we're opening sourcing paths to obtain those medications in a different way. It's the idea of let's go through the concept of true supply chain management and what does that look like. One thing that wasn't in Angie's bio that probably should be at this point is expert in international sourcing of medication. She does a great job of helping kind of find other avenues for employees as they so choose, to really find a way to for a win-win for everybody involved. Tammy, what about you? What's something what have been the most interesting aspects for you as you've gone down this path?
Yeah. Well, our path started in December, so we are baby steps into this thing. So, but I think the most interesting thing is really just seeing people's paradigm shift, right? So and we can continue, we've got a long way to go in education. But I am seeing some folks who are seeing some savings so we had an employee who went to a fairly expensive hospital network here in central Indiana. And with the help of what we have in place with Cisco and eLab and different things, they'd received their EOB. And in that, they only had a small copay to pay. And they're like, is that all? And is that all I'm going to have to do? And they were shocked by that. And I'm like, yes, you're in good hands. It's going to happen. And I think just seeing people appreciate some of those savings, but also starting to be a consumer and understanding that there are options and using that education right now is probably our biggest focus and our biggest win going right now, and we'll see more savings to be able to help as we go through the rest of the year in order to inform and educate people on where those wins are really coming from. But just that paradigm shift we're starting to see some, more buy-in and more people coming alongside of us like, yeah, this is going to be good. And that's been really important because it's when you first introduce it, hey, we're moving away from the 2 big boxes. That's scary for people, right? And that was a big, so that was a big challenge. But I think we're starting to see more buy-in over the last 2 months of a time with claims and people going and utilizing the plan and how effective it is.
I think it's interesting too. From Banning's perspective, you guys are very out front and showing how much you love your employees and showing how we're going to love you by helping you help managing costs and give you quality information. And this is the way we can show how much we care about you in the health insurance space. Nate, from your perspective, what's been the most interesting aspects for you or some of the biggest wins for the town of Plainfield?
Well, I share in some of the successes that Tammy and Angela has mentioned in different ways, but I think that the single biggest win and what's most interesting is our relationship with a direct contract. Our employees' behavior are driven by really two things: familiarity and convenience. We do the same thing at Walmart, right? If somebody moves something in an aisle, I can never find it again, so I get mad and I'll go somewhere else, or I use the self-checkout, right? It's about convenience. And our employees are literally driving by our county hospital, our partner, and going somewhere else when we could try to forge that relationship and get a partnership that is going to be mutually beneficial to both of us, and provide that convenience and that familiarity to our employees. And that's exactly what we've done. And so those relationships, it's all about the relationships now. And that extends to Connor, no commercial for them, but for Connor and all the other partners, and many of them that are sponsors on this session. It takes a village, right? It's cliche, but it does. And if you're getting a one voice solution from a single broker, then you're probably not enjoying in some of the successes that we are. But that direct contract also has extended into what we kind of a continuity of care. So our direct contract with our hospital, they operate our near site wellness center. They actually help us on the occupational side too. And when you could forge that relationship and overcome the convenience, you can drive them to the lower cost, best quality services and images and those types of things. And guess what? They just happen to be right here in our own town and our surrounding communities. So they don't have to go super far, because that's been the challenge otherwise. When you find the lower cost provider, that lower cost provider may be across town and it's not as convenient. So real behavior change for your employees isn't going to come until you can also make that perhaps convenient and familiar to them. And I think that's what has been most interesting to see and watch, and our biggest win.
I think there can be honestly a book written about the town of Plainfield and Hendricks partnership, Hendricks Regional Health, because they're a quality health facility. And you guys have leaned into that to create a really powerful partnership that serves your employees well. And it allows you to really invest back into your workforce with managed cost and convenience and all those things you just mentioned. And I think this is a really awesome example about why an off-the-shelf solution doesn't necessarily solve problems. In fact, it probably won't solve a problem at all, because I think of actually, Angie, your situation. So Nate and Tammy are in a community that has a really strong community hospital. Angie's situation, they're in rural Minnesota. It's a little different, and Angie's uncovered some things there. So Angie, would you kind of share a little bit about that and kind of how what the approach is from LSI as you try to kind of manage that circumstance?
Yeah, so a few years ago, our rural healthcare system actually was purchased by a larger organization. So we have seen kind of our rural community hospital, our rural community family practice clinics all become part of the same organization. And really that competition has gone away. We've seen our costs increase drastically from just even basic office visits. But also as we dig into claims, the colonoscopies or imaging are some of the areas where our costs have gone up extremely high in the past year, 2 years. This past year, we were actually able to partner with our local healthcare system, and actually here in about 15 minutes, we have another meeting with them. But just to walk through what is that cost of care and quality of care and how do we partner together? We have to have a local healthcare system that's going to be here to support our employees, especially in emergency situations. But we as an organization are also looking at and exploring what could an on-site clinic be for us. Nate, you brought up a near-site clinic. That's a huge aspect for your employees. It also helps encourage your employees, I'm sure, to get more preventative care or have their prescriptions on hand more often because they can get them in one easy, convenient location. So currently we're trying to take that approach in multiple ways. both with working with our current providers here in our community, but also looking for alternate options to provide that care to our employees based on the quality of care to improve. The great part for us is we get to also explore that same opportunity in many of our other rural markets in Missouri and North Carolina and Iowa and all those different areas, because it's not just one location for us. So how can we start small, start with one community, and then replicate that across all of our major population centers?
Yeah, and what I love about that is, one, you know your information and you guys are in the details on that. But two, you didn't just say, hey, well, we're just going to fight our hospital. We're just, they're now the enemy and that sort of thing. I think you guys have taken a really, intentional approach to say, we're going to have a conversation and we're going to give you the benefit of the doubt to move things forward. But we're also going to hold you accountable that if you don't, we're going to solve the problem. It might just be in a different aspect of with an on-site clinic or something like that. So I think it's a really good idea of how to address that issue. And again, it's just so interesting how you guys have just totally different experiences with the panelists on this webinar. We're in a real quick question. Does it take extra time to go down a path like this? And I see smiles and laughing already, but does it take time and is it worth it? Would be my question.
I can start on that one. It does take time. It takes a lot of time, a lot of research, a lot of looking at alternate options, a lot of digging into claims data and working with your employees. But it's also so rewarding and fulfilling when you can help your employees find the best quality care at a lower cost. So not only does it save the plan money, but it really saves the employee money, and you can help walk them along every one of those paths. This past year, we went through a TPA review process, and that was just extremely exciting to see other resources and tools that are available for our employees, and just continue to invest that time to find different solutions. It's not like you're going to ever be at the point where you can just walk away and say, we're done, we don't need to do anything. It's the continual process of reviewing your summary plan description, looking at what new resources are out there, and finding alternate ways. The health industry is constantly changing. So there's definitely job security. I don't think our jobs will ever go away, or there will never be another new solution, because it's constantly changing. So while the journey has been long at times, it's been a lot of fun to see the rewards that come out of it.
And I might just add from my standpoint, if it doesn't take time, it's probably not worth doing. I mean, if things come that easy, then how much do you actually value what that reward is? And I didn't have much gray hair before we started going down this. Ben's been doing it longer than me. Look how much gray hair he has. So it takes time, it takes energy. This is not easy stuff. And if it was easy, then we wouldn't be on this call, right? So we have to be engaged. I have to personally be engaged, as I said at the top. I mean, I'm fighting for my family too, and I'm not going to let other people have that conversation for me. And so get as involved as possible. Learn as much as you can. Use the relationships and the partners, because I think that the team, the village approach, especially with the right partners, is really going to help you through those challenging times. We've had a couple difficult years, but we had also built up enough reserves as a self-funded entity to be able to handle that. And what better reward than to be fully transparent with our employees and tell them all the costs. And we had a very difficult year, but to then say, because of your behaviors the 3 years before this, we have enough in the bank, we can absorb it. And then the next year, we're right back down. And so I can't express enough how being engaged prepares you for those moments. And then you can really manage through those because you have the partners around you. And so definitely it can be tough at times, but it is absolutely rewarding to be able to know that we have police officers and firefighters that have some serious health conditions, and their health plan is there for them. They can have to worry about it at all, and they can go focus on their family and getting better. And there's no better reward than that.
That's awesome. I think of control, like you have reserves and you can, I know you guys don't ever stop about the progressing the ball forward, but when you have reserves and have control, when you have those blips, you just kind of call it what it is and move along and make the next right decision. Not many people can say that. So congrats to you guys. Tammy, what would you say?
I agree, like I said, and we're just coming into the space. So I definitely, it's worth it. It is a lot of hands-on at the, from listening to Angie and Nate, it's going to be that way for a good period of time. So I think that, and I could see why, because I do think things change and they continuously change. And I think the more we can rock the market, the more success we can have overall. And I like, doing that. I think I like being part of that. And so yes, over time, it will benefit even a larger group of individuals than just even our organization, because the more people that come alongside us, the better opportunities we will have. So.
Yeah. I'm going to go to, before we close out, I'm going to go to a couple of questions and just rapid fire answer these, if that's okay. Someone asked, what is a captive layer? So just real quick, LSI participates in an employer captive. It's actually their own because they have multiple companies. And it's a term you may have heard before as a captive, but basically it's a stop loss solution that allows you to get a return on premium. When we manage the supply chain, we try to get an ROI in every aspect of the supply chain, and a captive can be a resource for that on the stop loss. One thing I would encourage, we do have a healthcare spectrum that talks about all these ways in which you can create an ROI within the supply chain of healthcare. But one thing I would always recommend is, and I'm sure everyone on this panel has experienced this, there is not one solution that is the silver bullet. So don't get too caught up in, that might solve everything for us. Well, probably not. But it can be an additive part to the solution. For instance, we hear a lot about, hey, if I go self-funded, I'm going to solve my problems. It's like, well, if you go self-funded and don't do anything different, you just have a self-funded health plan that operates like your old fully insured health plan. You might get some improvement over time, but it's not going to be wildly beneficial. Which goes to the next question that's been asked is, how much did you set aside for a reserve when you went self-funded? It just depends on how you build your health plan. So Tammy and my health plan are built in a way in which our reserves are kind of already calculated into the mix. But when it comes to Angie and Nate's program, I think what's really important, because everyone looks at self-funded differently. Some people think, oh my gosh, it's so risky. Other people say, well, I'm already kind of self-funded in my health plan because we know all of the insurance companies are making money on us anyway. So we're technically self-funded. They pass the cost along. My recommendation in that, though, is instead of just taking an opinion on risk and that sort of things, dig in and know the numbers. These three know the numbers, and we revisit them time and time again, and they hold us accountable to that. If we showed up and didn't know our numbers, there would be some friendly challenges that would be suggested back to us. Just to answer those questions real quick. So for the three of you, as we close up, what are you most proud of? What are we most proud that you guys have been able to accomplish through, pursuing something different in the health insurance or healthcare space?
I can jump start here, I guess. I'm certainly most proud of our relationship with Hendricks Regional Health and our direct contract. But beyond that, we've actually had 50% reduction in premiums since 2016. Our employees have not seen an increase during that span. And our individual single employees pay $5 for their insurance paycheck. So it's virtually free. In addition to that, we have a wellness program where we incentivize through additional HSA money so they can have their own money and they can use their own money. And if they do all of the different incentives, they can basically buy their deductible down to almost zero. So by default, with some participation, it's the only time I do participant ribbons. I'm a coach. I don't like participant ribbons otherwise. But in this case, we don't do the typical wellness programs that have challenging across the country when if you don't have a certain BMI or whatever, you don't get the points. Well, those are the very people we need to be in the program. So this is the time it works for us. And so if they participate, they get additional HSA dollars, and they can get up to the total contribution for a family of $4,000 in HSA contributions that almost buys their deductible down to nothing. And what we are working on right now, and anecdotally, I can absolutely say this, Connor's going to help me get the actual data. We know we have prevented catastrophic claims because of the way we approach this. And that's literally saving lives. And there's nothing that I can be more proud of than I know we've saved some lives on our employees because they can afford to get the care they need and find it early. And so, I think that that can't be overstated.
Okay.
I'm holding back a little bit. I'm waiting for year one to be really completed. I think right now, with that question, probably just proud of the team, the leadership team here at Banning, to make the decision to really jump in. And I think, it's a risk, and having the courage to do it. I'm very proud of our team for doing that. So, and then we hope to follow in Nate's suit, and be able to really offer some cool things down the road as we continue to develop, and Angie's too. But, for right now, it's just taking that leap of faith.
Have you guys been able to start dreaming about what that could look like?
Yeah, we are. I mean, we're starting to dream about that. And, Deanna is great to work with. We have a lot of good things happening. Our first thing, though, is we're just really getting ready to do our first survey and try to figure out where's the temperature, where are we? And I look forward to, getting those results in and seeing kind of where we are and how we can eliminate a few pain points if possible. And, to make it a program that works for the employees and their families. So.
Yeah, and I think courage is a great word. I mean, you guys started in December, and I think one of the hardest things is to make the change and do that education, as you talked about earlier. It's a different vantage point, and people tend to not want to learn about health insurance because it's so complicated, and to learn a different way it can be even more challenging. So kudos to you for stepping out in courage and really pursuing your employees in that. And as you guys get your program launched, it's nice to know there's savings along the way, but I know your guys' approach, just like Angie and Nate, is it's not savings, it's an investment. So when you have savings, it's opportunity for reinvestment. How can we dream about those things? Angie, what are you guys most proud about?
I think overall just the plan design, but I think the part that I am most proud of is our partnership with our customers, helping educate our senior leadership teams on the numbers and digging into those numbers to really make the right business decision. But then more important is the partnership with our field HR team and our employees. Today, I just actually sat down with one employee and worked through EOBs and how do you read your explanation of benefits and how do you make sure these items match up, and how are we helping them be better educated on those different healthcare costs. So I think that partnership is really the thing I'm most proud of, whether that is, again, with our customers, with our employees, and even our local community and healthcare industry. We can't do it alone. And so we're all in this together. And how do we do the best thing to help out our employees, help them get the care they need and be the best they can be?
Yeah, well said. And Angie's pretty humble, but I'll go ahead and say that the LSI team could run a clinic on how to do execution and how to continue taking the next right step. You know, that their organization has had a negative 1% trend for the last 10 years. That's minus 1% year over year for 10 years. And we talked to employers about the cost of inaction. We talked to Nate and Tammy and everyone knows the cost of inaction. If we do nothing, how much does it cost us? We were able to quantify that for LSI and their attention to detail. And their organization has saved over $26 million, conservatively, over $26 million by execution and pursuing a better outcome for their employees. And that's an opportunity to reinvest. It allows employees to take money home. Well, you know, when they're not wasting their paycheck on health insurance or this, that, and the other, it's going to their family, what they've worked hard to do. Tammy, Angie, and Nate, thank you so much for joining us today and for sharing your story. And thank you, everyone who attended. I hope this was helpful for you as you contemplate what your next step is. Thanks again, everybody. Have a good day.
Thank you.
Thank you.